Hi, my name is Manon Labreche. I'm the manager for the injury prevention team. The intent of the video today is just to provide you some ideas and suggestions on how to introduce the new Safety Matters brochure to your patients. Good morning, Robert.
Good morning.
How are you feeling today?
I'm okay.
You're okay? My name is Manon. I'm going to be your nurse today. We're going to do a little safety agreement today, but I'd like to review a little brochure with you today because I know you just came in onto our unit today.
Yes.
And your safety really matters to us, and I'm sure it matters to you as well. So we just want to review a couple of things to make sure that you're safe here while you're in the hospital.
Okay, sounds good.
We're going to talk a little bit about falls because falls are preventable because we have a lot of people fall in the hospital. Do you know why people fall, Robert?
I guess they're just weak and fall, or maybe medication.
Yeah, so they might be weak. They might be taking a new medication. You're not used to taking medication and you just had surgery. So sometimes medication can make you dizzy. It can make your blood pressure drop. So medication change could definitely affect fall rate. So we want to make sure that you know what you can do to make sure that you don't end up falling with us. Getting up too fast. That's another reason why people fall. So people fall if they try to get up too fast and go to the bathroom without any assistance. You never want to get up too fast, and you always want to wait for us and use your call light. So those are other reasons why people fall. So I'm going to just kind of go over a couple of things that you can do to make sure that you're safe, and I'm going to go over a couple of things that we're going to do while you're here. The first thing we're going to do is what we call purposeful hourly rounding. We're going to try during the day, every hour, to come round with you to see if there's anything that you need. At night, they're probably going to be rounding approximately every 2 hours or so. Okay. We're also going to perform a mobility safety check, and I'll demonstrate that at the end because every time we get you up out of bed, we want to make sure you're safe and you're able to stand on your own 2 feet. Okay. If we think you're at risk of falls, we might put a yellow wristband around your wrist, or we might give you some yellow socks. And you know, if we think you're a little bit higher risk, in that case, we might put a bed alarm, a chair alarm, or even a fall mat. So those are all precautions that we're going to take based on what we think your fall risks are.
Okay, sounds good.
All right. And then last but not least, for some patients that have a really hard time getting up out of bed, we might call on our specialized team, and they're going to use specialized equipment like ceiling lifts, floor lifts, equipment that'll be a lot more comfortable for patients to get up out of bed. So that might be a little bit different than what you're used to if if you've been in other hospitals. We want to make sure that you're safe and our team members are safe. So these are some of the things that we're going to do to keep you safe. A couple of things that you can do to keep yourself safe is when we do round Robert, please make sure to take the opportunity to use the restroom at that time. Even if you feel like you don't need to go to the restroom, we're here to help you at that time. So that would be a really good time to go use the restroom. Okay. Also using the call light. So if, let's say, you do go to the restroom with us during rounds, but then in between rounds, you need to use the restroom. So you're going to use the call light and you're going to call us. But most importantly, you're going to wait for us, right?
Yes, I'll wait. Yes.
Very good. And it's not an inconvenience. That's what we're here for, right? We want to work together. And every time you do get up out of bed, you see those yellow non-skid footwear?
Yes.
So we want to make sure you always have something on your feet so that you're not slipping. When we do get you up out of bed, we want to make sure that you go very slowly, don't go too fast, and really be mindful of your environment because, these rooms can get a little bit cluttered with personal belongings and other things. So we want to make sure you're not slipping, tripping, or falling over anything that's on the floor. So be very mindful of your environment when we're walking you to the bathroom. So this brochure explains to you the color level. Okay. So every time somebody gets up out of bed, make sure you hold them accountable and ask them, are you going to do my mobility safety check?
Okay.
And this takes no more than 30 seconds, Robert, but we just want to make sure that maybe they'll change your medication. Maybe you'll feel weaker one day. So we just want to make sure that all of the care team knows how you get up out of bed so that we're all consistent with how we get you up out of bed and what kind of equipment we're going to use. So the first thing we're going to ask you to do is roll over from side to side. If you're not able to roll over from side to side, then you would be considered a red or level 1, and that's what we would tell the care team you are.
Okay.
Once you're able to roll over from side to side, we'll have you sit on the edge of the bed, and we're going to see if you're able to sit there for about 2 minutes. If you're able to do that, we'll have you move your arms and legs. And if you're not able to stand, the next step would be to ask you to stand. But if you can't stand and all you can do is sit on the edge of the bed, then you would be a level orange, which is level 2. Once you're standing up, we're going to have you stand up there for anywhere from 10 seconds to 2 minutes. If you're good with standing, and we'll move on to the the blue level, and next is to see if you can march in place.
Okay.
If you're not able to march in place, but you can stand up, then we would mark you as a yellow. So this just helps us to make sure we use the right equipment so that you don't fall or get hurt, and that everybody's consistent.
Okay. It sounds very safe.
Any questions on that?
No, none
And
so
we're going
far.
to do this every time you get up out of bed. Okay?
Okay.
And like I said, it doesn't take very long because we're going to run through it right now.
Oh,
Are
okay.
you ready to get up out of bed?
Yes.
Okay.